So I'm Rebecca, I'm a psychologist, and I work with people predominantly who've got experiences of bipolar disorder under that umbrella term, so highs and lows in their mood. I work in an NHS service called Pickup and elsewhere too. For people with bipolar disorder, often that's not the only difficulty that they experience. So often people who have real highs and real lows in their mood have other things that they find challenging too. So we know that when we see people for therapy, they might also have a diagnosis of ADHD. They might have difficulty with kind of concentrating, with persisting with tasks, with kind of getting things done the way that they want to. It's really, really common for people with bipolar disorder. I think one of the reviews fairly recently said it was about 80% of people with bipolar disorder also meet diagnostic criteria for an anxiety disorder. So anxiety is incredibly common for people with bipolar disorder. And lots of other difficulties are commonly experienced too. So things like difficulties with alcohol and other substances might be really, really common. Difficulties with relationships, trauma, and other symptoms of psychosis. So these things don't exist separately. Often people don't fit into neat diagnostic categories, and actually what we're interested in is what's going on for this person, what do they need our support with. In terms of thinking about, from a psychologist perspective, from my perspective, what help somebody with bipolar disorder and other difficulties might need, a lot of the time, a therapist might be able to think for the person in front of me with the different difficulties that they've got on their plate, let's come to an understanding of how these things might be connected, what overall is getting in their way of their goals. And we don't need to do a therapy for ADHD, a therapy for anxiety, a therapy for bipolar. We can think a therapy for what's getting in the way of your goals to help you live the life that you want to live. And that's what in the ideal world we would want to try and be offering. Sometimes it is true that there are kind of real specialisms and specialist services for particular difficulties. So a common example of something that co-occurs with bipolar is an eating disorder. And you might find in an eating disorder service, having a nutritionist, a dietitian, a medical doctor, as well as a therapist can be really helpful to have that kind of wraparound approach to care. So sometimes you might find that a therapist is recommending a particular service or a particular kind of therapy. But for lots of people, seeing a psychologist or a therapist for the different difficulties they're experiencing, not worrying too much about what they're calling it or which one is the most important, is still really, really helpful. So we've got a bit of an evidence base to guide us in terms of what might be helpful to offer to somebody with bipolar disorder, or what might be helpful for a person with bipolar disorder to seek if they're looking for some help and some psychological therapy. We don't have really, really encouraging evidence that there's one model that works for everybody. So what we know is that for somebody who's experiencing difficulties with highs and lows in their mood, and those highs become really problematic, they reach what we would call a diagnostic threshold for mania, that CBT alongside medication has got the best evidence base. But CBT is a therapy that can take into account other difficulties that the person's experiencing. So the therapist might be able to formulate how a traumatic experience that the person's experienced has an impact on their current mood. You might be able to take into account how their current anxiety plays into the changes in mood that they experience. So CBT can be offered in what we call a transdiagnostic way, so to account for lots of different problems that the person's experiencing and try and help with them kind of in one piece of therapy rather than lots of different therapy approaches. But there are other therapy models that are used with people with bipolar disorder too. So some people find kind of therapies like dialectical behaviour therapy really useful for learning kind of tools and strategies to manage moods, particularly low moods, and to manage difficulties with other people. Sometimes their services might offer something we call psychoeducation, which is a kind of package of information, if you like, either shared with the person and other people who have similar experiences in a group setting, or with families or with carers. So we know that giving people lots of information empowers people, doesn't it? It helps them understand what they're experiencing, recognise that other people have those experiences too, and think kind of with people around them, kind of how best am I going to manage these things? So there are different therapy models for different things that the person might experience. There might be lots of different things available depending on the person's individual experience and what they need help with. So if you were to be looking for some support for somebody, either you yourself are experiencing kind of ups and downs in mood and you need some support, or somebody that you think that they might benefit from some support, there are a few different places you can go. So we would always be recommending to people that they start out by visiting their GP and letting them know, because your GP is often the kind of gatekeeper who can refer you on to other NHS services like psychological therapy services. But actually there are kind of sources of information out there that you can access for yourself too. So Bipolar UK is a charity, and they offer quite a lot of things like Zoom support groups, some in-person local groups you can go and meet other people or other kind of supporters of people with bipolar. They've got their own kind of information sheets. So if you're wanting to try and understand your own mood, what are my high moods like, what are my low moods like, they've got resources like that on there, mood scales you can use. Loads of different informational videos. There's also a research centre in the UK called the Spectrum Centre, which is based at Lancaster University, that have done quite a lot of the newer research in terms of psychological therapy for people with bipolar disorder. And they've developed a relatives education toolkit that gives you some information about bipolar disorder and how to support somebody with bipolar disorder. And you can get hold of that on their website. That gives you kind of those bits of information you might need if you want to understand this a little bit more, how it's affecting the person that you're supporting and how best you can offer them some support if this is something that they're struggling with.